Hi Lois, how are you? Good.
Can I put this on my door? Do you think anyone's gonna freak out if I
What? No. What?
do this?
No. No.
Because I need to make sure that
Ingrid, you're not muted.
Hey, good afternoon, everybody. We will get started. I will give the floor to the chairs for our October 22nd regularly monthly TCB meeting. Any welcoming remarks? Try chairs. Good afternoon. Just want to say hello. We saw each other yesterday, so many of us, and I thank you for your time yesterday and for joining us again today. I think this will be a very significant and important meeting, and I just look forward to diving in and getting feedback. So I just want to say, nice to see everyone, and turn it over to my right, James.
Hi there. Good to see people. I want to say hi to Yancy, first time. I think you've joined us, right? So, Community Voices, correct? Yep. So, welcome to the circle, and we look forward to hearing your voice. And also, I wanted to do a shout out to Alice because she's not able to join us in person, but you are a rock star, Alice, still showing up for meetings. We appreciate you. And that's pretty much it. Pass it on to Claudio.
Good afternoon, everyone. Great to be here. I'm sorry I missed yesterday, but I heard it was really a fantastic workshop and look forward to having a more of a high-level briefing and discussion today with the full TCB. Great that we have UConn reporting out on some things that have been items of interest for this board for a long time, including governance and some of our infrastructure work. So really excited to get the report out, and thanks for all the work that happened up to this point. Thank you.
So the next agenda item is just a motion to approve the September minutes.
So moved.
Second.
Approved. Thank you. So I will go ahead and share my screen. So the first thing on our agenda is just some administrative updates. So some work group upcoming meeting dates. The System Infrastructure Work Group will meet November 18th from 3 to 4:30 on Zoom. The services meeting will have to be rescheduled as we are actually moving the November TCB meeting to November 19th at that time. So please stay tuned for the rescheduling date of that meeting. The school-based next meeting will be November 3rd from 3 to 4 p.m. on Zoom, and prevention will be November 20th from 3 to 4:30 on Zoom. So next, I'm going to pass it to a few of the Community Voices work group members to talk about the October 10th summit that we had a few weeks ago.
Good afternoon, everyone, TCB committee members and community. My name is Jenny Bridges, and I have the pleasure of being here today as a member and representative of the Community Voices Work Group, also known as CVW. With me, I have my partner in community,
Adriana Ramirez with Connecticut Family Support Network.
And on October 10th, we had the opportunity to get together for a summit facilitated by a great organization, Health Equity Solutions. And it was our first summit, and the morning consisted of discussions around lived experience, the power of storytelling, and work group building activities.
It was an amazing day, and a lot of great exercises and interaction and really getting to know each other and the passion that we all have. So we're very much looking forward to the second half that didn't happen, with the second half of the TCB coming together with the CVW group that I know that is in the works. So hopefully we will have a date to be able to share, because to continue that momentum from the first day part session, with the ability of Taylor doing such a great job. And Jenny and I wanted to ask if any of our members are present either here or Zoom, if they'd like to share a sentence or two about their experience of that day of the summit. We'll give it a couple seconds because I don't know who's on Zoom.
So the CVW is also we're gonna plan to utilize the discussions that we had at the summit to build on our work plan, goals, and priorities. And again, we hope to bring that to the larger group here. Thank you.
Thank you.
Sorry, and actually the next slide, I'm going to give the floor to Claudio
This is in reference to some of the adjustments that have been made, or some of the work progress that has been made in a couple of areas. And so, Claudio, do you mind if I give you the floor?
Sure. And I'll can tip to Tammy too, who has been an instrumental partner. So we've made really fantastic progress. It's been a collaborative effort with the UCCs, with OPM DSS team, TCB, trying to figure out, one, how we look behind the intervention that's typically 3.5, 4 hours long at a UCC, and break down that experience into a bundled rate that more simplifies and allows the UCCs to take full advantage of the funding that we put in the budget. So for those who don't know, we put $7.68 million as a total Medicaid line item, and we had some concerns about whether, due to billing and the overlapping billing when you have serving the entire family co-located at the same time, that there could be an issue of maximizing the billing. So very happy that we have very recently issued a bulletin updating that rate, streamlining the billing process, allowing the UCCs to do what we believe is fully access and take advantage of the funding that was put in the budget, and recognizing that the UCCs also may need a little bit more of a supplemental payment in FY26. There's a little bit of extra money, so to fully expend, we're going to do a supplemental payment as contemplated to further support the UCCs. And I know they've also worked incredibly hard at taking the charge and direction from the TCB to work extremely hard to get commercial rates and to get really solid commercial rates as a staging ground, so that it's not just individuals and children who are Medicaid served, but the entire continuum and payer source for children's behavioral health services. So I want to commend them for the partnership and how far we've gotten. I think it was touch and go a little bit, but we sort of plowed through and have really gotten into, I think, a stronger footing than we had thought, and we're still going to keep building. So I congratulate them for that work. And in addition, I want to say I think there's been some real good conversations in the subcommittee group that Howard has been leading for us about what else can we do by way of awareness building and socializing the idea that UCCs are really there as an important diversionary tool to ED, emergency department placement. So Howard, I want to thank you. I want to thank Rep. Exum and Senator Marr, and also Representative Nuccio, who have committed to trying to do more outreach and ready-made programming for community conversations so that people feel more comfortable using the UCC. So that's the one thing that's very good. And Erica, I'm not as familiar with Griffin, but this does sound terrific. And I know Griffin Hospital, under the leadership of Pat Charmel, has been always a visionary person. So this idea of a new alternative that he's putting forward, I'm very excited about it possibly being a model that we can scale up. And I have every confidence, given his visionary work in the healthcare space, that this will be a good program that we can build and learn from.
Yeah, and thank you, Claudio. And I think part of this too is that as we are evaluating our Connecticut services, right, and this is another area in our crisis continuum that we can, we're working to invite them to come and sort of do some level setting and informing us about these enhancements that they're doing to their services. So again, more spaces for learning. And I see that Alice has her hand raised, so I will give the floor to Alice.
Just very quickly, do you know how they're paying for it? Is it through the hospital billing codes, or is it an outpatient? Anyone know?
I don't know, but I don't know if anybody else around the table does, but we will be, we are in communications with them to invite them to a TCB meeting to do some more level setting and learning. I think this is a space for us to learn how, the progress and what they're envisioning. Yeah.
So the next slide, just quickly, we have been noticing that at Talue Justice Institute, our emails may be being blocked by state agency servers. So this is just a reminder to please check your quarantine to make sure that the emails are going through. And it might be different for some, but this is some advice I got if you do use Outlook. So I believe a next item on the agenda would be passing to Deborah.
There we go. Okay. I'm Deborah Harberger, and I am Director of Policy and Financing at Innovations Institute at the UConn School of Social Work. We are a center within UConn. Been there a few years now, though we just celebrated our 20th anniversary doing work. And it's a pleasure to be here with you today. I'm joined by my colleague Jill Farrell, who will present in a little while. And we are presenting on 2 reports that we did over the past year on behalf of the TCB in response to questions that were posed to us. So hopefully everybody has received a copy of the report. This is just a screenshot of it. The ask was to present information on national approaches to governance. What does governance look like really across child and family serving systems? So really thinking about when populations cross and aren't within any single system. So that was the focus of the scan that we did. And we provided it in June of 25, although a lot of the work and research was done prior to that, culminating in December of 24. And as noted, we did speak with folks yesterday, a lot of folks yesterday. Those of you who were with us for a workshop yesterday, this is a little bit of an updated version from what we talked about yesterday. I'm sorry, I've too many things up. There we go. Okay. So before we really dig in, I just want to acknowledge that kids' systems are different than adults. Kids require a different kind of interagency coordination. Many children involved with public systems who have complex behavioral health needs cut across. They get involved with child welfare, juvenile justice, education. And when we think about how to design systems, services, and supports for kids and families, we really can't just utilize always structures that exist for adults. And so the need to think about how kids cross systems and interagency coordination governance to support them in some ways is a unique thing to the kids system, and is a little bit different and something to consider. So today and for this session, we are really thinking and talking about governance. We're talking about system structures and accountability for policy, financing, decision making. While really, really important, not focusing on system management, and we're going to pull that apart in a moment. We're not thinking about the care pathways. How do kids move from, entering a system, entering services, through seamlessly to another service, to getting the supports they need in their homes and communities? What services exist, where their workforce challenges, all of these things are critically important, but are separate from the issue of governance. And so we're really talking just about governance today. And calling out the fact that single agency, single system reform and initiatives are important. They're where a lot of the work gets done. The work that happens inside of a child welfare agency, inside of juvenile justice, education, critically important, and it's the day-to-day workings of our infrastructure. But what we're really talking about here is where we have shared population focus and accountability. So where do kids and families cut across systems and touch multiple systems? And as we're going to talk about a few times, one of the refrains in systems of care, and many of you are very well versed in this, is when everybody's responsible, no one's responsible. And that is really the hallmark of this. How do we help support consistent accountability, responsibility on behalf of a defined population of kids and families to make sure that they're getting what they need when they need it? These are just a couple of quotes. One was from the Aspen Institute and Forum for Youth Investment. They have spent a lot of years doing a lot of work with state government and with children's cabinets and looking at where there are opportunities. There's some form of children's cabinets in a majority of states, whether those cabinets are really kind of at the same level. Some of them are really cross system, some of them single population. They take a very broad definition in their use of the term children's cabinet, which is fine. But the point that they've recognized is in specializing, we create these silos. And the silos are sometimes where the important work gets done because you have subject matter expertise, technical expertise, you have resources, but it becomes really challenging when kids and families cut across systems. So how do we make sure that we have that coordination across and that we're all being responsible to, as they say, for listening to and holistically responding to the needs of kids and families? Because that's really at the end of the day what we're trying to do here. when we think about structure, which is definitely not the most exciting thing to think about, we have to make sure that it happens. Certain functions have to have structure, and we can't just assume that they're going to happen. Sometimes we get lucky, and sometimes structures work out. They work themselves out. People come together and make them happen. But that doesn't always happen, and that doesn't always lead to great sustainability. We also know that what worked well in our state, in our community, maybe 20 years ago, 30 years ago, may not work now. There may be changes. We're living in a moment with a lot of change, right? And so there's a lot of changes happening at the federal government. There's a lot of changes happening across communities. There's new challenges every day. And, you know, utilizing structure as a way to bring people together and have consistency and transparency can be really important. But there's no perfect or correct structures. And so we're going to talk on a little bit about some examples from some other states. I don't know that I would argue that any of them are perfect or have, you know, everything that you want to emulate. I think it's more of an opportunity to think about what exists, what maybe do you want to borrow or use to inspire you? What do you want to use to say, hey, we actually like what we have in Connecticut a lot better? And that's fine too, right? So some of this is just getting a sense of what's out there, what are people doing? But what we don't want to happen is just going on and assuming everything's working just because we're not paying attention to it, right? Structures are how we distribute power and responsibility. It's how we hold ourselves accountable, and our values are going to shape those structures. So when we're talking about governance and systems management, there's a lot of different definitions for these terms. And one of the reasons we were asked to do this scan and give this presentation was to help with some level setting, give everyone the same foundational information. Some folks were part of a strategic planning day about a year and a half ago where we talked about some of this. Some folks heard this yesterday. Some folks can present on this themselves very, very well and do. But you know, these are the terms that I'm using. These are this is the terms from our system of care primer. And so this is when I say governance, we're really talking about this decision-making authority regarding resources and policies needed to build and sustain system of care specific initiatives. And the key bullet points about a governance body, they have to have the authority to govern. They have to actually be able to do the thing that they're set forth to do. It needs to be clear what they're governing. What is their scope, and what is outside of scope? Do they have the capacity, including resources, personnel, time, other technologies, and do they have the credibility? Do they have the expertise to do the work? And when we're talking about interagency or cross systems governance, which is what we're talking about here today, they have to be able to have shared accountability across a population of focus. And that is where I think that becomes really challenging. When we're talking about systems management, that's really the day-to-day operational decision-making, the management of resources, the people who keep everything running, and then they report to governing bodies and external stakeholder and oversight entities. Within a single system, you might see that governance and system management look the same. Within a small jurisdiction, a town, a county, a program, a provider, the people who are the governance entity may also be the system managers, but when you're talking about large public child and family serving systems, when we're talking about kids with complex behavioral health needs that cut across systems, the systems managers are the people running these agencies and doing this work. The governance is the people who come together above, they coordinate, and they're really where that buck stops, that authority stops. Certainly, you could argue that the governor is where that stops, right? Or the president at the federal level and all of that. But functionally, how do you have the expertise across these systems that they come together, they're convened in such a way that they have that authority, that credibility, and the resources? It is really important that people with lived experience, that providers, that legislators, that members of the judiciary, that stakeholders are present, give input, give oversight, hold people accountable. But in I'm going to say our experience at Innovations, we have seen that governance structures typically exist within the executive branch of government, because executive branch is the branch of government tasked with implementing, and that is ultimately, you know, where you'd want to see the ability to do this. And then all these other branches of government, all of your stakeholders, everyone else is there to hold everyone accountable, shine a spotlight, push, advocate, and make sure things are still going. And that is where we see a lot of states that do have governance structures for cross-system populations have advisory councils and oversight bodies that inform and that hold each other accountable. But they're not ultimately the ones governing, because again, if everyone's responsible, no one is responsible. So these are just, this was, those of you who worked with Sheila Pyries, she really said a lot of this and was very helpful in helping a lot of us conceptualize systems of care. And this comment from her in the primer was, you know, sometimes we see these governance structures get created and they're created without being staffed. They're created without being resourced. They're created without the right authority. And that ends up undermining the whole process. And then people think governance doesn't work, or they think that people don't care about kids and families, right? And I'm calling out the fact that right now this is a challenging fiscal environment, right? So not at all trying to pretend that this is an easy task or something that is quick to accomplish, but thinking about it, making sure that what you decide you want to do, you're doing thoughtfully and well resourced to make that happen. So we're going to go into some state examples. Those of you who were at the workshop yesterday, we went through some of these. I added a little bit more information on a couple of them. I am going to talk a little bit about Connecticut too. Once we get through these examples of what we've been able to identify as maybe some of the components of Connecticut. But first, we're going to go through these other examples. This was not a comprehensive scan. We did not look at all 50 states and the district, right? We looked at a handful of states that had interagency cross systems children's structures, right? That's what we looked at. And then there's places for you to say, I want to know more about this, or I want to know more about this. You know, how do they do this? And that's certainly something that can be followed up on. So Maine has a children's cabinet. The chair is a commissioner. They're staffed inside of their Office of Policy, Innovation, and the Future. They have statutory authority for this children's cabinet. It's a combination of federal and state funding. And I know that the tri-chairs had asked yesterday about some of the funding and how much it costs for some of these. I did some digging. We're going to have to do some more digging if you want even more, but it looks to me like Maine, I can't find the money for the children's cabinet itself because I think it's embedded inside the budget for the Office of Policy Innovation. However, they did appropriate $1 million a year for their Children's Cabinet Early Childhood Advisory Council to do their work within the Children's Cabinet. And it's explicitly tied to being within the Children's Cabinet. And that fund source is 50% federal and 50% special revenue is what they're doing with that. So $1 million for the Children's Cabinet Early Childhood Advisory. Maine has these two primary goals. One's early childhood and one is young people transitioning to adulthood, and that's where they get a lot of their work, whether it's behavioral health, education, or whatever, under those two big broad umbrellas. So we would have to dig more, talk to people, really get beyond what's just listed in a budget book kind of thing if folks want to know more. Maryland, and I told folks yesterday, as many of you are aware, we Innovations used to be at University of Maryland, Baltimore. We were the Center of Excellence for the State of Maryland Children's Cabinet, and worked deeply in Maryland, so a lot more familiarity with that model. Actually worked at the Governor's Office for Children for a couple of years, a long time ago at this point. That office has had a few different iterations, but the Children's Cabinets existed in Maryland since 1978. And it's had an interagency fund. When it was first established, that interagency fund, the funds actually came out of state agency budgets individually and moved so that there was people felt that money coming out into this collective fund. Over time, that changed, and now it's a line item in the budget on its own. Looking into the budget yesterday, it's a little bit hard to pull apart their budget for fiscal 26. It looks like they have a little, like about $750,000 for operations and about $3.5 million for personnel, but it's a bigger operation. And if you look at their full budget and scope, they have a whole initiative that Governor Westmore has pushed out called Enough. That's about ending childhood poverty. These funds don't include the grants that they're administering, but it looks like it includes the people who are administering the grants. So there's a whole infrastructure here. Plus, there's an infrastructure of oversight to the local management boards and some statutory authority that it rests within the Governor's Office for Children. So this is not just $3.5 million to support the Children's Cabinet. It is a lot of personnel for a different thing. So it's not exactly an apples to apples, but it does start giving you a sense of scale and scope. That is an office that really, it grew very, very big, and in the early 2000s was over 100 people in that office. Over time, it then scaled back. The legislature had it sunset, and it came back smaller with some of the functions pushed out to other agencies. And then it kind of grew back up a little bit under Governor Martin O'Malley. And then under Governor Larry Hogan, it was very, very quiet for a long time, and actually moved out into the Governor's Office of Crime Control and Prevention and was kind of off to the side. Governor Westmore has elevated it again. But what I think is relevant is that they have the separate interagency fund, and that they've historically had what I would call a deputy level folks that come together to meet regularly to do the work and inform their secretaries and keep the work moving in between. There were periods of time where there was, in 2008, there was a large interagency strategic planning process across the Children's Cabinet that really set forward the priorities for a number of years. There were other initiatives and iterations, and I think what you'll see with a couple of these different Children's Cabinet models is they pick a topic, a priority, an initiative, and really hone in on it. Historically, Maryland's Children's Cabinet was very focused and interested in initially bringing kids home from out of state who were in residential care and across state lines. Over time, it evolved. They really focused on wraparound and care management entities and kids' behavioral health issues. Right now, under Governor Westmore, there's a big focus on ending childhood poverty. And so that is kind of a whole of government initiative and focus and he's grown the cabinet and grown some things. And so we'll have to see how successful that is in doing that. And if that's too big a scope, if it's just right, we'll find out. Massachusetts doesn't have a governance structure in quite the same way. I bring it up because, as a neighbor and a state that has some really great kids behavioral health services, it's worth noting that they really formed the Massachusetts, the Children's Behavioral Health Initiative in response to the Rosie D. EPSDT lawsuit. So they operated that. It really was a Medicaid initiative that came inside of the Mass Health Office of Behavioral Health. That's still where it sits. And our colleague, Kelly English, we asked her opinion. Certainly it's just one opinion, but she noted that her experience, and she's still working there, and she worked under Rosie D. She feels like right now there's not a well-coordinated or integrated system because it's deep within the Medicaid office. And it's sort of inside of a single agency, inside of state government. That's her opinion. There's different feelings. There's some workforce challenges like every state is having. They did a lot of great work under Rosie D. I think they saw a little slippage, as states often do post lawsuit settlement. So I don't think that they have an interagency kids governance structure the way we're really talking about here. Minnesota, however, does have a children's cabinet that they have Governor Walz really reinvigorated and invested in. It was established in 1993. There's a bit of a legislative history in the that you can find online about it sort of being reinvigorated and then kind of going a little more dormant for a while. Unclear why. But Governor Walz really re-elevated and said that kids are how we're going to make this state, the best in the country. And they are supported by the Minnesota Department of Management and Budget. They seem to have $1 million a year for their budget for the Children's Cabinet. That's what I was able to identify. And it sits within the Department of Management and Budget. Their meeting frequency is unknown. They don't have a published schedule. They did have a public meeting just recently at an elementary school where the whole cabinet came together, had a very public meeting. You can find clips of it on YouTube and everything like that. They do have an advisory council and some cross-agency leadership. So they're working and meeting, but it doesn't, I sent out an email. I don't have a response yet. I don't have a sense of how often they meet or what that looks like. It seems like it's not as published a schedule or as set a schedule as some of the others. But it does look like it's about $1 million a year for their operations. New Jersey, also raising it because they have done tremendous work, really good work around kids systems and service array and access. But I would suggest that their governance structure is really their systems management structure. They have a children's system of care. It is inside of state government. It is an agency that is tasked with doing this.
but it isn't necessarily convening the other agencies. It is the entity charged with doing this. And so really it fits under more of that systems management idea. They have braided funding from many sources. They have been very successful in supporting kids and families and getting services out. But again, that's more specific to their systems management, how they have designed service array, how they've designed access, how they've invested in their administrative service organization, and used that as a single point of access, created a Medicaid lookalike number. There's a lot of things. Those are all about their system structures, their service array, their access, and not their governance structure. And this is just sort of a diagram of New Jersey's structure. Again, it's really this New Jersey Department of Children and Family and Children, their children's system of care, and then they have their Medicaid agency. They meet regularly. They've been able to sustain things through relationships and through just historical information sharing and things like that. But they don't have an interagency governance structure in the same way. And then New York has a Council on Children and Families that is staffed, and it's an independent agency. There's a mix of fund sources they use with some philanthropy in there. It is unclear how often they meet, but there is this cross-system deputy commissioners meeting that meets monthly, and those folks do meet. They talk about interagency initiatives and effort. I'll note that they have a class action lawsuit that they're responding to. They are not alone in this. Lots of states are dealing with this, but related to access to community-based services for kids under 21. And what we're seeing is like the Department of Health and Office of Mental Health are really working together a little bit with the Office of OCFS, their child welfare agency, are working on this, but it seems outside of the Council on Children and Families, which has maybe a slightly different purview. So they're an interesting model. I don't think that they're quite the same as like what you see in Minnesota or Maine and some of these other states. So then when we look at Connecticut, the governor did establish a kids cabinet. This information, folks in the room might have even more updated information about this. There's not a lot online. We talked to somebody last December, when this was all being written. Certainly the establishment of this demonstrates a commitment to interagency work and cross systems and coordination. The membership looks a lot like the membership of a lot of these children's cabinets. I don't know if it has been able to meet regularly at this point, or if it's a little bit of a hiatus as there have been shifts in staffing and leadership. So recognizing that might be a little in flux as things change. And, it's tricky because it seems like it was established as an advisory group, right? And being established as an advisory group is different in terms of charge than being established in statute or executive order as an entity with governance responsibilities. So an advisory council is different in that space. And these things take a while to get started too. So it sounded like it had good energy, good excitement. I'm not sure exactly where it lands, and maybe we talk about that later if folks have thoughts on where that is. And then just calling out the diagram of all the oversight bodies and all the advisory bodies and the groups that are really trying to do such good work in Connecticut. And again, just taking a moment to say, what is oversight? What is systems management, and what is governance? There's a lot of folks who have really important input to provide. And it's really hard when everyone's responsible and no one's responsible. So I have the chart again. I did not put Connecticut in this chart because I think it's a little bit more nuanced to think about that kids cabinet and all the different oversight bodies. And again, each agency does its work and does its work well. And there's lots of groups then doing coordination and working together. It's a question of, is there in fact an entity in Connecticut or multiple entities that you would define as the governance structure for cross systems, populations of kids with complex behavioral health needs that are not responsible for daily systems management, but hit that decision-making authority, that aren't a planning structure or an advisory, but actually have the responsibility and the charge of governance.
So that would really be what I would encourage folks to think about in doing this is who or what is that? Does it exist? And it may well, and maybe folks have additional things to add to some of what we've talked about, or maybe it's an opportunity for something else. So that is the scan. And looking forward to people's thoughts, questions, comments.
Thank you for that scan. So I guess taking a step back, I think that there's a piece of this puzzle that's obviously missing. And maybe because I sit at OPM, I'm seeing it as obviously missing, is that the Office of Policy and Management in Connecticut is the governor's staff agency with responsibilities for governance across all of our state agencies, cross-agency planning, long-term planning, funding, budget decisions, resource allocations, labor management, bonding. And I think when you look at the examples that were raised as sort of a gold standard, like Maryland, again, it's the budget and management in Maryland that's the anchor. Maine, similarly, attached to the governor's office as a staff agency for the governor with budgetary decision making. It seems to me that the analysis is incomplete unless there's a full understanding and appreciation for the unique role that OPM, Office of Policy and Management here in Connecticut, plays across all of our governance system.
Over there, Tammy.
Thank you. Thanks for raising that. It's a similar point, actually. I think that we can recognize that there are variables about how states are structured and other things in those states that kind of intersect or interplay with the kinds of cabinets and structures that you have discussed. And one of the things that I'm interested in is that the kind of the state's structure around Medicaid, I imagine, is one of those important variables. And not all of those states, but almost all of those states, in fact, almost all states are Medicaid managed care states. And I think that affects a little bit about, kind of how they implement and affect, children's behavioral health across systems. And I was just interested in your perspectives on the role that Medicaid payment structures in states affects the governance structure.
So I think actually to both of those points, I think it's a question of scope and authority and the purpose of convening. So what are you convening people for, and how does everyone have a voice at the table across these agencies? And so you may be able to do that within a state government agency, and that may work well. Certainly, it's a question of sort of charge and bringing people together and elevating voice so that there's equal voice at the table, right? And so, and who has the expertise around kids systems and cross systems, with a clear focus on these particular goals and objectives that you're trying to achieve. So there may be structures that exist in states that can be leveraged, including in Connecticut, that can be leveraged to address this cross-agency population. And maybe it's already happening, or maybe it's an opportunity to leverage that. With regard to Medicaid, I think it doesn't necessarily have to impact the design, because when we see these children's cabinet type models working well, what they're doing is they're identifying a particular issue or population, and then they're figuring out how each of their agencies participates and has a role to play in thinking about access, referral, service array, payment, all those things. And so the Medicaid agencies becomes a critical partner in that. And in that work, and thinking about what authorities exist already, what authorities could be leveraged inside of Medicaid. New Jersey and Maryland both have ASO models. So, I think when we look at how Maryland has done it, Maryland Medicaid has always been at the table, along with the Maryland Department of Health, Behavioral Health Administration, the Child Welfare Agency, Juvenile Justice. And though that entity, Department of Budget and Management, has always been at the table and a critical part of the Children's Cabinet, but the chair of the Children's Cabinet has always been outside of that role, so that the Department of Budget and Management has a seat at the table, like all the other secretaries have had a seat, and then everything gets reported back to the governor. And nothing got decided on without budget and management, but it was sort of an equal seat at the table with all of those partners.
I see Mickey's hand, and then Alice. I think Alice, your hand was up first, and then Mickey. Is that okay, Alice?
Sure, thank you. Claudio, thanks, because I was thinking too that OPM certainly plays a role in this. And it was interesting, Deb, around what the budget was to run the cabinet itself. But I was also really interested in what's their power and authority over which budgets, right? Like how dollars are spent. And I think you just mentioned a little bit what was going on in Maryland, and equal footing, but tell me if I'm correct in this assumption that a really good governance structure would have the authority to help people braid and blend funding to be able to meet the goals that ultimately the state wants to achieve with the various funding streams that are used in all of those areas that you pointed out: education, behavioral health, physical health, and that graph. Is that kind
Yeah.
of the way to think about it?
That is a yeah, a great way to think about it. So, and I think that's why you see some of these cabinets have a designated funding stream. So the Maryland Children's Cabinet has authority over the Children's Cabinet Interagency Fund. It does not have authority over the Department of Human Services budget or Juvenile Services or Maryland Department of Health's budget, right? And all budget requests, all budget authority, all budget everything still goes through the Maryland Department of Budget and Management, right? And so the
Right.
Children's Cabinet Interagency Fund, any spending, is still getting signed off on by the Department of Budget and Management. But the Children's Cabinet is making these decisions about spending and authority, including issuing RFPs and pushing out money to local departments. And what we saw for probably about 15 years in Maryland was a building of an infrastructure related to tiered care coordination wraparound and keeping kids out of residential services when they weren't needed and bringing kids back home. And what happened was there was funding out of the Children's Cabinet, and then the other agencies also piggybacked onto contracts from the Children's Cabinet and our agency fund to support their populations. So there were care management entities that were rolled out across the state, and there were certain populations of kids that had access to certain funds. But then there were a SAMHSA system of care grants, and there were funds from child welfare and funds from juvenile services, and they bought in, piggybacked onto the contract, and there were set slots and opportunities for those kids using the infrastructure because they had all bought into this model through their interagency strategic planning and this shared vision around population. So
Right.
everyone's at the table. Maryland Department of Health was at the table related to anytime Medicaid was part of it, because we had at the time a 1915 CPRTF demonstration waiver that we were implementing. That was a population of the kids getting served. So different kids were being funded different ways, and that was mostly braided funding, not blended, because we had to track every dollar and report outcomes differently. But that was being supported kind of across. And then there were other pots of money that were for kids who didn't have another way to get access to the service. And that's what the Children's Cabinet Interagency Fund helped support: the kids that didn't have an entree through the system of care grant or through the demonstration waiver or something else. The Children's Cabinet Interagency Fund was able to support that. It was finite in its capacity, but that's certainly a role that they had, and then every secretary was at the table for that.
Yeah, I'm sorry. I know Mickey's going to talk, but I think that speaks really important to Connecticut, right? Because it's really only at that level that you can kind of look at the whole scope, right? And, having the children's cabinet with lots of people on it from different groups. But if there's a mutual agreement, and then OPM or policy and management can work in tandem with that group to be able to get the biggest bang for the dollars, right? I mean, that's sort of what you want. It reminds me a lot of the ASO in Connecticut, right? Because it's multi-funded through DEMIS, DCF. I don't know who else, Andrea, you have, but it's kind of an effort like that in some ways.
All right, Mickey?
Yeah, I'm just curious in terms of what information do we have regarding these examples and their ability, who is evaluating their effectiveness, right? So it's creating an entity, or somebody has created an entity that has seemingly lots of responsibility, but how effective are they, and how do they demonstrate that? How do they tie outcomes for kids in with their specific work?
So it's going to be, state by state look differently. I think, again, I can speak to Maryland, which I'm really speaking more historically, but they use results-based accountability in their and in their budgeting process. They always had, for years, it was managing for results, and they had specific data points that were the Children's Cabinet interagency outcomes that they were tracking. They issued annual reports on results and kids' well-being across the state around key performance measures. Again, those were population indicators, right? They're not performance measures. So differentiating how much you can move the needle for an entire population based on, a limited fund source is always a question. But there were interagency measures that were identified, and that was what was being tracked. Under different governors and different approaches, there's been more or less of an emphasis on data and using data. I did see that under Governor Moore, it looks like those data measures are back up and people are tracking them again and better with dashboards and other information. But I think that goes back to establishing who is the population and what is the scope. When you look at it for any of these children's cabinets, I think it becomes really challenging if you're saying it's for the whole of the population for an entire state, right? Versus saying, first, we're going to look at kids with complex behavioral health needs who are, at risk of being stuck in an emergency department, right? Or kids who are experiencing homelessness and are in our elementary schools. Like there's sort of a finite population where you can put resources and invest this interagency work and do sort of tests of change and see what's working. And so, I think Minnesota has a report card that they've sort of put out and some progress reports that they've put out. They have really talked about how they've used their structure to leverage additional funding and resources and policy priorities. And they have a little performance report that they put out that highlights all of those things that they're doing. And so I think it just depends on how you're defining the population of focus and then what are the measures. And then if you're funding something specific that's service related, like Jill ran a lot of the evidence-based practice evaluation work for the state of Maryland. And so, the Children's Cabinet contracted with us to do that evaluation, outcomes monitoring, and report on it. And you guys use CHDI for things like that in Connecticut and other things, right? But how do you leverage your partners and have data around things that you have invested in across multiple agencies is another way. So sort of at the individual and service level. And then there's population measures, but you don't want to look at the population measures if that's not tied tightly enough to your actual scope.
All right. Any other, Jan?
Thank you. First of all, thanks for the report. I know it's not comparing apples to oranges, different governments, but it's like apples, some are in a tree, some are some are at the farmer's market, some are in a bag, but it's very complicated. The lens through which I'm sorry I missed before, but the lens I was looking at in my mind in trying to put this together was maybe just some of your thoughts. What is the goal the state is setting? Who is setting that goal? Who are the agencies? How are they communicating, and who's the ultimate authority, right? Or those are just some pieces of it. And in implementation science, obviously, it's the people and moving the people. And so here I see, are we agreed on a goal? Probably not. And who would agree with that goal? And how do you get a system with the slide that you showed at the end that had so many pieces? How do they self-assemble into a coherent, and they can't self-assemble into a coherent piece. So then who is assembling them? How are we assembling them? So these are just very challenging questions, clearly, and I don't know if you have any additional thoughts about that.
I'm not an expert on Connecticut, right? So I'm going to say that right from the start. I'm getting to know Connecticut, not an expert on Connecticut. What I would say is it seems to me in a narrow way, your Children's Behavioral Health Partnership is probably one of the closest versions you have to this, but it's still kind of narrowly defined and tight, right? And it's not kind of as broad. It has a narrow charge as it should. But I think you have pieces of things that are working well where you have agencies coming together with real authority to do things every single day. I think it's a question of, is that more systems management or governance? But I think it's at the end of the day, you have this body, you have a few other bodies that have been meeting that have some policy priorities. Where do you have shared policy priorities, and where can you tackle one or two of those that require multiple agencies at the table? Like, I think that's the question. If any one agency could do this, if they had the resources and the information, then it's not an interagency initiative. It's a thing that we want to make sure everyone knows about, right? but what requires multiple agencies at the table and to get something done. And to me, that's where you start when looking at the policy priorities for your children's behavioral health plan, the work of TCB, your individual agency strategic plans or other documents. What is the policy priority that really requires at least 2, 3, 4 other agencies, plus the kind of resources of government, and starting there with a couple of things and not trying to do all of it at once. Because I think you have a lot that's working really, really well in Connecticut. And so, what do you just leverage and grow and, figure out we're stuck because we're not working together. Like that would be the question that I would say you should think about. Where are we stuck because we're not convening ourselves regularly? We're not coordinating regularly. We don't have an implementation plan. We don't have a clear, way forward. And we're being reactive. What is that? And that would be a place to start.
Commissioner?
Great, thank you. Thank you so much for that, the report and the conversation today around this. I'm sort of wanting to echo a little bit some of the feedback and comments that we've heard already so far around sort of encouraging and making sure that we're doing a thorough, sound assessment of where are the gaps in our current structure. And to Mickey's point, how do we measure whether the structure that we have is it a structure governance issue, or are there other areas that we would want to identify as a system that we would need to improve on? Because I fear sometimes and I mean, some of us around the table were here when we created the Connecticut Community Kid Care Initiative and legislation so many years back. And just encouraging all of us as a group to really identify before we jump to what's the right, governance or structure. Let's find out what's the scope of I'll say problem, but what's the scope of what it is we're trying to tackle? And then how are we going to measure, is it working, is it not? I do think that we have pretty good interagency collaboration on trying to figure out solutions, particularly that are needing to be a little more creative, braided funding, some other things to really accomplish the goals that we collectively share. And then maybe there is some purpose in echoing what Claudia was saying around having some overhead structure around connected to statewide policy responsibility and statewide budget planning responsibility to help to come up with those solutions and fill those gaps. But I do appreciate the conversation, and we're certainly interested in the continued partnership to figure out how do we want to move things forward once we understand where the gaps truly are.
I just want to say, I probably said this more yesterday in the workshop, but we do work in a lot of states, and we point to Connecticut all the time as a state that's a great example of how to do work in kids' behavioral health and child welfare and a lot of kids' systems. So we are not approaching this saying, oh, you're starting from someplace. Like, we think you're probably, I don't know, top 5, right? And so that's probably everyone wants to be number 1, right? So I probably should have said number 1. I'm so sorry. I'm sure you're number 1 in things. I'm sure you're number 1. But like we do point to Connecticut, right, as a good example of good work. So this is a question of like, is this a gap? Is this a need? Is this your issue? And I think it's probably worth asking the question, is it your issue? Is your issue something else? Is this a mechanism for you to address what you identify as your issue, right? That might also be because structure matters and structure is important, and you have a lot of folks convening for lots of different reasons all the time. What is the symptom? What is the actual issue? And is a governance structure or cleaning up a governance structure, clarifying the governance structure, just being a little more precise, does that help you address what is actually the thing you want to get to?
Christine?
Thank you. I sort of have an observation and a question. I mean, one is I think we tend to be fairly crisis driven and sort of solving for the last problem, right? In general, when it comes to children's mental health and some other issues. And it sort of gets this question of like, well, where are the gaps and how do we know where the gaps are? And I think in the data conversation, there's sort of this recognition that we don't have good population need level information, and we don't have good information on like who's waiting for what. And so my question in relation to that is, do any of these states that you've given us as examples, or are there any other examples of states that do a really good job of understanding the population level needs and then designing systems to address at that level, and understanding, who are the children that are going to need services as we move forward, and how do we plan for those needs, rather than sort of reacting of, oh, we've got a population of kids whose needs we're not meeting and we have to try to figure out how to do that in sort of a reactionary way.
I think we'd have to take that back and give it some thought if there's anyone who has a great example of that and looking at the population data. I think there's a lot of states that have done that well in various moments. I think sometimes it's done in response to a lawsuit, and then they put into place systems and structures that can be really helpful. I I think sometimes they do it for like a systemic care grant, especially when it's a statewide one, and that can give you the opportunity, the thinking room, the money to do that well. Um, Back the children's mental health transformation grants back in the day were a way that states would do that. So there's states that have sort of that legacy component to it. Um, I think it depends on the structures that are in place to then use the data intentionally and use the work intentionally. And that's where I'm not sure that we see consistency all the time. We see drop off because you can even have something in statute, but if it's not being, if nobody's bothering to, make sure it's being implemented, if people aren't bothering to convene or look at the data, there, I think it's just, that's all a question of the data and how you use it. And I think that'll probably speak well to some of what Jill's talking about too. But I do think there's a lot of examples of moments of states doing that. Yeah.
I did see Andrea's hand raised, and then Alice, and then we do have to move to the second presentation as well. So, Andrea, I'm not sure if you still wanted to ask a question.
No, I think it was really addressed the things that I was thinking about. Thank you, though.
Okay.
Appreciate the recognition.
No problem. Alice, last person to ask a question, and then we'll move over.
Sorry, I wish I was there with you guys. I want to echo what Commissioner Hamilton said, is that there's 25 years of history of, building here in Connecticut. And I think that the area of work, if we were to do it, it would be really focusing on the idea of the interagency blending, similar to the way the ASO is done. So I think that the financing of the initiatives and oversight is really some of the areas that we could really spend some time on. I just want to echo that. Thank you.
May I ask just one question before we move on? I'm just curious, when looking at the other states, um, what's the role of the legislators? Are they typically a part of this work, or is it something different? I'm just curious.
Yeah, I think they tend to be involved in an advisory role. They tend to be an oversight body. They get reports. Like in Maryland, there's a joint committee on children that the children's cabinet agencies always report to, and they come with reports, and they have back and forth, and they get a charge, and they I think help in that way. But and then they maybe have roles on the advisory councils to those cabinets. The cabinets themselves tend to be made up of just the executive branch secretaries or designees. And then you have the advisory structures and then the oversight bodies with that back and forth. And certainly any budgetary requests, depending on the state. I think that Connecticut has the legislative body has a stronger role in policy making than in many states. And so I think that's reflected in some of these structures.
Thank you very much. I was just really curious about that. I think one of the things that's been nice is being able to kind of hear some of the initiatives we'd like to do, get the recommendations, and be able to help with that, and with OPM with us as well, and all the input from everyone in order to kind of push some of that forward has been something I think I'm wondering if it's unique or if it's something that you see in other states. So thank you. Okay, Erica. Thank you.
Thank you so much. And now I'm going to give the floor to Jill Farrell, who's actually has come to you before in the giving a big picture around the data services collection. So very familiar with Joe. Thank you.
Great. Thank you, Erica. And I think I need to share my screen. Okay. Okay, thank you. Sorry, I'm good. Hello, everybody. My name's Jill Farrell. I'm a research scientist working with innovations. It's housed within University of Connecticut School of Social Work. And I was tasked, and let me pull, oh, I lost my, okay. Thank you, Deborah. Sorry, I lost my screen. Um, and with my colleagues, thank you. We were tasked with doing a review of children's behavioral health system data infrastructure and looking at, what are some best practices, what should states have in place, and then looking at Connecticut's current infrastructure to assess where Connecticut stands, where are some strengths and potential limitations within your state, and then to draft a kind of scaffolding for a potential plan to move forward with that to address gaps. So I'd like to acknowledge my co-authors, Bert Plant, who many of you know. He worked within DCF and also at Carillon for many years and knows data in the state quite intimately. My colleague, Terry Shaw, who is a faculty at University of Maryland School of Social Work, and he worked within integrated data systems in several states, so has a good sense of what it looks like in other places. And then my colleague, Deborah, here, as well as Michelle Zabel. So to set the context here, I'll just set the stage with the fact that the children's behavioral health system obviously is very complex. There's many entities that deliver, coordinate, fund, and provide services that across prevention, early intervention, treatment, and cross systems, behavioral health, education, juvenile justice, child welfare, and developmental disabilities. So with all those systems and the different providers that they're working with, your data collection is coming from many directions. And to pull that together to look at this from a state lens is obviously going to require a very comprehensive, robust infrastructure. The goal of this report is to help understand what would be the components of that infrastructure, and then how do you pull apart of what do you need to have in place in order to answer the questions that are important to the state. This kind of fits nicely with where the last conversation was going with governance and what's important to us and how do we know that we're having the impact we want to have. And, I think my goal in this presentation is just to go, what is the base so that you can build off of, and then ultimately hopefully identify the data that you need for your particular purpose and what you're trying to change, and to make that data usable for you to implement. So the report content, just to orient folks who haven't had a chance to go through it, the beginning section goes through key concepts and components. This is mostly designed for folks that aren't steeped in data every single day, and to give you a sense of, what are some of these things that folks are talking about? How do they all link together in a way that's hopefully going to make it usable so you can engage in the conversations? The next section focuses on model approaches, best practices, and innovations for data infrastructure and use of data for quality improvement, kind of giving a broad landscape so that to help ground the conversation generally, and to point people in directions for where to look for potential resources to enhance infrastructure. Then we walk through Connecticut's behavioral health infrastructure, and Bert Plant assisted me with identifying the primary data systems and folks that we could speak with to do some kind of deep dive profiles on the agencies and identify strengths and potential limitations when you're looking at this system data infrastructure as a whole. And then we move to some recommendations for moving forward, as well as provide content related to a glossary. So start the base for common terms for folks to use across systems, And then profiles that I just mentioned, we supplies the summaries of those deeper dives. I won't go too deep into the terms and concepts section, but I did want to just ground that data infrastructure is composed of systems, technologies, processes for data collection, storage, management, processing, analysis, and reporting. So it's the structure that helps us understand, well, from collecting the data from the users to all the way from the folks receiving services and participating in your systems, all the way to the folks using data to help make decisions and use the data for system planning, improvement, etc. So it's a lot happens to make these systems function to get to that point. The two pieces of rather than going through these terms explicitly, I just wanted to point out how some of these infrastructure or how these systems are structured so that because they become relevant to understanding what you have in place currently. So I'll just point down to the, the C, which is a representation of an integrated data structure in which you have systems contributing to one piece, one element that does all the integration and then makes that data usable. The D is a representation of an interoperable data system, and that's where information is flowing seamlessly from one to the other. Well, that's a simplified version. It's not necessarily all information flowing from one to the other and in real time. It might just be near real time. The goals of these systems often start with providing information to folks who are providing services and doing case management, care management, coordination. So it's at the person level usually, but it's an excellent infrastructure for connecting information across systems that could then potentially be rolled up to support higher level planning and decisions. I'll also just raise the term data governance since we just spoke a lot about governance. Particularly when you're working with multiple systems, contributing data to one system, having a strong data governance structure is important so everyone is really clear and there's agreement on the policy, standard, processes, roles, and technologies that are going to make sure the data is used, managed properly and then used properly. A lot of these data, behavioral health data, have statutes and regulations around how they can be used, shared, stored, et cetera, at the federal level and state level. And then the agencies might also have rules. So the governance structure ensures that those, the experts in how that is managed can contribute to how that carries over until when you're providing data to another system. And ultimately, all of this is in place to ensure security and appropriate use of information from individuals without compromising their data and identities. All of this is for the sake of trust. So we have all this data. I know I get regular notices of breaches and wonder where my information has ended up in some of these spaces, but having good mechanisms in place to that very sensitive information about ourselves and our children, the governance structure helps, ensure there's good processes that are transparent. Beyond just data security and management, integrating data across multiple systems, there's risk with this because you're using identifiers to link, one person to another person. There's so beyond just literally data security, there are challenges that take resources and effort and capacity technology to manage. The quality of the data can be an issue in that there might be data missingness. The structures of the data might differ. So in all of this, having good stewards who are able to make sure that we're keeping within the statutes, regulations, restrictions of data use, and also the expertise to understand how the data is, what it can tell us and what it can't tell us, and how to use it well to tell stories is really important when you're pulling data from different systems into one structure. So that because systems are designed so differently, children's behavioral health systems, as we were just going through the different structures from different states. When talking about children's behavioral health data infrastructure, we kind of broke it down to elements of how you would, things you want to see in place or consider when trying to build out this infrastructure and support it. And then when you're, identifying things that might need to be enhanced or bolstered, then you look to different places or initiatives where they're doing these things really well. So you might look, so the buckets we establish include having foundational infrastructure where all data linking can actually happen. Governance, we just talked about, so having good models and approaches for that. This all takes effort and funding to put in place and then maintain and enhance over time. Needs are going to change over time, so you'll have to stay a little bit nimble to as your priorities shift and change data's or bring in new data that will help inform your initiatives. Having mechanisms to make the data transparent is very important. So dashboards are wonderful, have advanced rapidly, I think, within the last 10 years. They're easier to develop and easier to publish so that people have access and just functional in terms of visualizing information in ways that people can receive and understand and then work with this information. So those I'd put in their own bucket as important elements to consider. Having clear goals over what you're trying to achieve in terms of performance and designing performance measures that align with that. And then having structure for how you're going to pursue quality improvement if something's not trending in a direction that or trending in a direction that you'd like to shift, then that's one other pocket of information that you'll need to plan around. And then finally, looking at innovative technologies that can help make all of this taking advantage of the innovations that are coming out rapidly, particularly with AI, and how can that make our work more efficient and solve some of the problems that take a lot of staff time when you're working with data. If you can have AI do some of these processes that would take a person weeks to do, then you start to become more efficient and can put that money elsewhere. Okay, in terms of the section on models to look at, national approaches, innovations, I'm just going to walk you through a few of the examples to ground you and what's the content is, but I won't go too deep in all of this. For children's behavioral health, anything that integrates data connected to children's behavioral health at the national level, we identified here. So state longitudinal data systems are education focused in that they were initially funded through Department of Ed. Well, they were funded through the Department of Education to support linking data from early childhood all the way through workforce. So you can see how children progress through that their development. That infrastructure, that funding also supports the infrastructure that you can start to attach other systems to. So states have included juvenile justice system data, correctional system data, child welfare related data, all within whatever's allowable through what data sharing rules. All payer claims databases link healthcare, health insurance claims across Medicaid and commercial insurers and become kind of your go-to database for healthcare costs funded through those mechanisms, including behavioral health. And then finally, health information exchanges are funded primarily to help support healthcare at the individual level, but these are the interoperable data systems that I mentioned earlier that support a structure for linking information across systems, agencies, that in theory then have this wonderful mechanism for rolling data up to look at more population level data in real time or near real time, which is the key there. Because information has to flow across to support care, which is, more requiring real-time access. Data a lot of these integrated data systems have lags that don't allow for the immediacy. And you're looking at something from 2 to 3 years after things have been processed and pulled together. So there's, I think, potential in what health information exchanges can offer. The report covers examples of integrated data structures from a local jurisdiction in Pennsylvania, as well as South Carolina. These examples were primarily there because they've been doing this a very long time. South Carolina from the 1970s, and then Allegheny County, Pennsylvania since 1997. Allegheny County just puts a lot of documentation out there about what they do and how they did it, that could be useful when trying to resolve certain issues. I won't spend too much time on these, but I did want to know, as the state moves forward and trying to figure out how to resolve specific issues, these would be the types of examples of where we'd send people. In terms of QI and model approaches and best practices for quality improvement, there's not this kind of one-size-fits-all approach that we would recommend for everybody, but there's a general strategy of starting with identifying the performance measures that would align with the initiative or what folks are trying to accomplish. Identifying a framework. Deborah mentioned that Maryland used results-based accountability to align with how they assess data and then use data for system improvement. Plan, Do, Study, Act is another framework that helps support small tests of change to see if you can make something move in the direction that you're hoping for. I pulled out, these models all require teams and collaborative type efforts to drive the improvement, because they require stakeholders from the practice level all the way up to the system level of whoever's involved with what's trying to be accomplished, because everyone has a role and interpretation of data in a way that's going to hopefully identify potential barriers and or solutions. And then finally, I highlight dashboards again, because I think their importance for transparency and accountability is just worthwhile of constantly repeating. And the idea of data visualization that's gonna help people quickly see what's happening, and then also track that over time to identify what they want to focus on. For Connecticut, we reviewed the following system. So last fall, Bert and I met with folks from Carillon and representing the Connecticut Behavioral Health Partnership. Their system pulls together all of the data of Medicaid members, and they compile a lot of reports and assist the state in quality improvement efforts through their regional quality managers, and a lot of other reporting that you can find on their website. We interviewed the Department of Children and Families and CHDI on their provider information exchange, the PI database on the DCF side, and EBP tracker on the CHDI side, as well as CHDI runs performance improvement centers related to a lot of the evidence-based practices, which is their approach using a lot of the best practices to support improvement around services the state's very invested in. We interviewed on the juvenile justice side, the judicial branch for court and support services division, and their contractor data collection system, which is collecting service data on anything that they fund and whoever they're contracting with to provide services or operating themselves. And then we met with folks who manage your all payers claims database, your longitudinal data system, the statewide longitudinal data system that I mentioned earlier, which in your state's called P20WIN. And then the Office of Health Strategy, who oversees the Health Information Exchange, Connie, for your state. So the last three I'll just highlight. These are integrated data systems or interoperable data systems that your state has invested in and have been operating for a while. So you have this infrastructure that's not all states have, and so it's quite a great asset when you have the expertise and a lot of lessons learned of how to pull this data together. And also, some of these systems have been operating for over 10 years. So you also have a lot of data connected at this point that could be used to inform your system efforts. I'll just also highlight some additional partners and resources within the state that are great assets. So within your Office of Policy and Management, the Data and Policy Analytics Division, they manage a lot of tools and efforts that support data integration, use of data, you know, within the department, and then also supporting the state systems themselves. So there's a Connecticut State Data Plan, which has the goals of this data plan would light wonderfully with, supporting the children's behavioral health data infrastructure. So aligning with that plan would be a recommendation from our report. They operate the open data portal. This is an excellent asset to the state. A lot of times I'm going to work with states with other states and trying to find information on children's behavioral health and end up looking all over the place and happen on information. Currently there's not necessarily all the website or behavioral health data stored in this one place, but it is an asset and something to consider you could go to this, it's easy to find for citizens all the way up to other stakeholders. And just moving along, I'll also highlight the Office of Health Strategy, who I mentioned earlier, oversees the All Payers Claims Database and Health Information Exchange. Again, lots of expertise and lessons learned within there to help inform if there's additional data integration efforts needed. On the other side, we have the Children's Behavioral Health Plan Implementation Advisory Board, and specifically their data integration work group, who's been at this for years already. Several years now, they've been focused on what does the state need to pull together, understanding that this is a cross system, this work goes across systems, and so how they started mapping, and they've even released a dashboard very recently that starts to pull together some of the system information, and this would be a wonderful place to start with and look at for efforts moving forward for data. And then I've listed some websites that house data that might be related to specific initiatives depending, or goals of the group, depending on where folks are focused. And there's a lot more. We link to a lot of websites in the report. So overall, in terms of strengths, I think we walked away with there's a sense of very strong state expertise in data governance, integration, and like how to do this work. There's really strong foundational infrastructure in these data systems, such as the State Longitudinal Database or Data System, P20WIN, the All Payers Claims Database, and then the Health Information Exchange, Connie. There are robust data assets across state agencies, and their partners in Carillon and CHDI and others, and also strong analytic and QI partners in Carillon and CHDI and others. So you've got a wonderful base in terms of approaches. And then also there's emerging dashboards that are specific to children's behavioral health. Since writing this report last year, we learned about that the All Payers Claims Database launched a behavioral health dashboard that's publicly available now. And then since yesterday, we learned about one through the Children's Behavioral Health Plan that is also accessible publicly. And you're number one. Okay. Sorry. And in terms of gaps and opportunities for development, so data is not available for all populations and all services across the spectrum. that is a problem if you're looking at whole population. But then if you're going to start somewhere, the data could be there for this who we are trying to solve problems for at this point. In some examples, so there weren't data on services for folks who are uninsured. There isn't necessarily data available related to outcomes for all services. So the report has a few more details related to that. There are lag times in data availability, especially if you're relying on claims data. When health insurance claims have to be submitted and then processed and then integrated and prepared for all this for analysis. And that can take months to years to have ready and available for reporting and quality work. There are variations in data definitions and quality. Not all data, so for instance, and that this is actually a data gap for the health information exchange. Not all behavioral health providers are currently in Connie or submitting data to Connie or participating in Connie. So that would be a limitation in terms of data being available there. In terms of limited data related to things that we've heard about that the TCB might be of particular interested in, we weren't finding good data in terms of service capacity, wait lists, or unmet need, the population needs. And so that could be an area of focus. We also found fragmentation in reporting and dashboards. I found myself kind of going, all the websites and digging down and trying to centralize that could be a potential goal of the work groups. And not all services have QI processes in place. So the state has rightly invested in ones that have then priority services to get out there and make sure they're working effectively for the state. But the others, there's probably worthy looking at others to see what we would want to know about them and ensure they're having the impact that we would hope. So overall recommendations include a primary one of establishing a work group or utilizing a work group structure to help identify, I'll go through the plan in a moment, what we would recommend the group would do. The intent of a work group would be with having data across so many systems and agencies and having so many stakeholders who care about data, pull something that's interagency and that allows for varied stakeholder participation would allow for a lot of voice, especially as you're starting down this path. As you identify where you want to focus, that group can kind of shift and be tailored to what data stewards need to be at the table, and what other stakeholders would add valuable voice to that group to make sure you're getting what you need out of it. So starting with a group, and we came up with recommended activities that I think could shift because with this, the content in this report was really compiled almost a year ago. A lot has happened in a year, and I think anyone that's coming together that's relevant to this table is gonna probably want to shift some of this around based on what's already been accomplished and what are the real low-hanging fruit based on capacity and resources within the state as of now. So the recommendation would be to start with 3 to 5 year plan, develop that to align with the goals of the TCB and the state priorities, and establish a regular reporting process just so people are staying informed. With data developments they can feel really slow sometimes and then a lot happens. And so just keeping a mechanism so that people are staying informed, particularly across agencies, would be valuable. First, initial activities, just finishing the mapping that we started would have value so folks understand what data exists where and what doesn't exist. Identifying working with the state to align performance measures with the strategic goals and state priorities. So what are the key things and kind of setting up ultimately what data you're going to need to be able to be effective within this group. We have in years 2 or 3 moving to capacity building. Again, these might move depending on what's low-hanging fruit. But how do you leverage your state longitudinal data system, your all payers claims database, and Connie for potential performance measures, analysis, and evaluation activities? For providers who aren't currently participating in submitting data to certain systems or some of these systems that could provide information to the TCB, working on clear guidance for data sharing and consent to share data from the participant level is also really important and can just hopefully facilitate participation in the overall in these integrated data systems. Promoting agency-specific dashboards, just from the lens of helping state systems be more efficient with their own data. And then with those designs can inform what comes to something that's hopefully more public-facing down the road. And consolidating, I mentioned that kind of was going all over to find relevant data currently. So just trying to consolidate that could even be a step forward. Finally, in terms of longer term activities that the group could take on, would be focus on those public facing dashboards. This might shift because some currently exist as of now that would be potentially aligned with what folks need. And also looking at AI for how the state, how could AI help the state be efficient in some of these data integration activities and reporting activities that take currently a lot of manpower and would just as a potential better use of resources. And finally, ensuring accountability and transparency, that kind of carries throughout, but keeping a focus on that to be transparent with the information needed for folks to fully participate in the TCB, have access to information they need for informing what's next and what's going on currently and what's going to happen next for efforts. So just to summarize, the state has a very strong foundation. Continued work's needed to strengthen the TCB and state's ability to use data effectively for decision making and improvement. And next step should be focused on what's going to support this initiative in the state generally. You don't have to put together an infrastructure that does everything, be focused and targeted with it. And I believe our team believed that a coordinated work group would be very helpful to support this to move forward. So that is all I have.
Okay, any questions?
Yeah, thank you, Jill. I just want to recognize one of the things that you pointed out as really being a valuable asset, sometimes maybe misunderstood or not fully appreciated, but the Connie system that OHS operates in particular, because we have a state mandate that every health provider has to connect to Connie. So that's such a powerful tool for having holistic, fully integrated data with our health system. And I know we're working really closely with OHS on figuring out if there's any opportunities even within the rural health grant application to add additional dimensions, including non-clinical care and beefing out that aspect of it. So appreciate you recognizing that as a strength. And I think that's something that we'll certainly take back. I think we need to leverage that as much as possible and considering more upstream interventions too for our children's behavioral health system. So thank you.
So I have a totally different and sort of out of left field question. When looking at all of the resources, the additional Connecticut partners and resources, we know that we can tell by usage on websites. What are the hits on a website? Tracking the connectivity of the website, the information, the data. Is that something you've ever thought about asking people if they actually what their usage is on all this? Because I looked at some of the websites and they're lovely, but if nobody's using the information to inform decision making, that's my question. Might be something we want to start asking.
Yes. And yes, I'm thinking of work that I've done with states where they've launched dashboards and we'll track it to see if traffic's being driven there. I think dashboards, one danger of them is they can be very easy to create and there's so much data, you can just kind of put a lot out there. So without purpose and driving the design, it might not get the attention because people don't know where to go with it. But intentionally designing something that supports your needs would be a place to start for sure.
Well, unfortunately, I hate to say this, but we could probably ask AI and they could tell us.
That would be true.
But never mind, I didn't say that.
But Senator Mar, one thing, and thank you for asking that question, because we're contemplating that a lot in the JJ world as well. And one of the things that we did there is we did it in partnership with parents, in partnership with the Office of Policy and Management and Judicial Branch Court Support Services and several members of the committee. We created a user guide because sometimes a lot of that understanding of those dashboards is kept in-house. And it's so siloed, right? Instead of, and they're supposed to be public and transparent and it's useful, right? But the question becomes, how useful are they if only a certain few can actually understand them? And so I think that those are some of the things that I've observed. And as I look at dashboards, they are so high up there in the analysis piece of it, or even trying to find the information to navigate the dashboard, that becomes so unuseful and then it's a tragedy because there's so much value in them, but if we can't understand how to use them or what we're reading, it makes it very inaccessible to us to use them.
Completely agree.
Sorry, just had to comment because
No, thank
we're
you.
having that conversation right now. I just feel very strongly about how do we create these dashboards that become very useful and are kept updated on a regular basis.
And the other thing is, on some of these dashboards, they are really geared towards the industry and the academic side of things. So if someone is searching for help, they may or may not be of any help to the public.
Any other questions, comments? Anybody on screen? Sorry, just don't want to miss anybody. No? All right. Thank you. Thank you. Everybody, I do want to make a comment that we do have. First, I want to say thank you to Jill. I know, and Deborah, this has been in the works for some time, so really appreciate it. And I appreciate you both coming to Connecticut to do this presentation. So thank you so much for your time. The other thing is I do want to, and it was mentioned earlier by Emily, but just want to make sure everybody has this information. We are changing or the November TCB meeting, as there is a discussion about a special session, and that was creating a conflict with our TCB meeting that was scheduled for November 12th. So it's going from November 12th to November 19th, same time, and it will be a hybrid as well, where it's in person and some in virtual. But for the chairs, would you like to have the floor for any closing remarks?
Oh, sorry.
I would just like to say thank you to Jill and Deborah for bringing this information forward today, and thank all of you, especially if you heard some of this yesterday, but it's so much information, so it gave us an opportunity to kind of digest and go through it again. Lots of things that we can think about, lots of things we can be proud of. I still think that it's more information, it's more opportunity to reflect on things, but Connecticut's unique, and we'll continue to work together and kind of figure out our next steps. But it's good to kind of see where we are, and use your word, Erica, kind of level set where we are in comparison to other places and states. And so thank you for that. And I am freezing. So I don't know about you all, but it is so cold in here. So I'm ready to go outside. But thank you so much. And here we go.
Just also thank you. And I will let you go. Claudio, anything?
Just to say that this has been a piece of key information that we'll use to reflect on for recommendations moving forward. And obviously, it's been a topic of interest from the beginning of TCB, is to get a handle on governance, what works in Connecticut. Proud to see some of the things are really shining examples here, but how do we iterate off of other state best practices? So thanks, everyone. 2 minutes.
Yes.
Literally
Yes.
freezing.
So,
Dire.
we're trying to get, sort of starting to get convinced